everyone for being here. I really appreciate you taking time out of your busy schedules. Dr. Harris, it's great to see you again, looking well. I know your schedule is tight, Dr. Harris. Dr. Reece is going to talk a lot about our epigenetics. Dr. Finn's going to talk a lot about some public safety numbers, and hopefully we'll have time for some conversation.
That's great.
Take it away, Dr. Reece. Thank you.
Okay, fine. I'm just going to try and share my screen here, see how we go. Okay, that says brain development. Is that right? Is that what you got?
Yes, sir.
We have.
Okay, so that's the thing of brain development from science, and this is the US autism rates. You can see it's exponentially growing, and you can actually model it. We've published this, and you can see that it's higher in the high cannabis states. In the projections, because it takes 8 years to diagnose autism. So of course the figures are 8 years behind, but you can do the projections just based on these, and you can see there's a big difference, 455, 282, the high and the low cannabis states. Now, the best autism data set in the world for genes is the Safari data set, and there are 1,100 genes there. Of those, if you run them through the cannabis genes, which are epigenetically known to be affected by cannabis, published in the North Carolina group from Duke University, 600 of the 1,100 there, 55% of the autism genes are implicated in epigenetic dysregulation of cannabis. And there's the two URLs for that. So if you can summarize that, this is the fetal brain development. This is the genes identified in the cannabis database. This is the genes. This is the genes identified in this database. This is the genes implicated in cannabis. And so about 30 to 40 to 50% of these genes in brain development and autism are implicated by cannabis disruption. And this is the North Carolina group led by Dr. Murphy, Rose Schrotz, chief investigator. And this is sperm. You can see the sperm are deformed here. They've got up to 4 heads and damaged tails and damaged mitochondrial head pieces. So you can see why. So this is looking at schizophrenia. So this is a big paper in Nature about schizophrenia. They listed 685 genes in schizophrenia, and of those 597 were identified in the epigenetic screen from North Carolina. So it's 87% of the genes implicated in schizophrenia are also disrupted by cannabis. And of course, sperm is the vector for a lot of this. Males smoke more weed than females, of course. So this is the sex determination genes in sperm. There are 417 genes identified in this paper in Cell Research, and 120, that's 28% of them were disrupted by cannabis. So you can see that sperm is obviously a vector, intergenerational vector. This is congenital heart disease. We've published lots of defects of the heart, and this is a paper. This is Nature again. This is looking at congenital heart disease, just come out in August. 2320 genes in congenital heart disease, and of those 1,160 or 50% were disrupted epigenetically by cannabis. Now this is important. This is what Christine was saying. This is the structure of some of the common cannabinoids which are out there, THC, cannabidiol. And you can see that the core molecule is the C ring. It's the benzene ring with the pentenyl aliphatic side chain off the side. So there's benzene, that's a known carcinogen. And that's a levitol, that's the C ring. That's the core of the cannabinoid nucleus. They've all got it. And that's the genotoxic moiety. So, you know, it's confusing in the US. My friends tell me they've got Delta 9 and Delta 10 and Delta 0 and Delta 8 and all that. The point is it's the levitol core nucleus, which is here, which is a genotoxic moiety, which is obviously related to benzene. It's a dihydroxylated benzene with an aliphatic side chain. And that's the genotoxic moiety. So that's why it comes out in cancer. We've published extensively on cancers. Now, this is a paper that's just coming out on Europe. We've looked at all the European cancers as well as all the US cancers. I think we looked at about 26 cancers in the US. We've looked at 40 cancers in Europe. And the findings from Europe and the US are almost the same. Now, this is interesting. This is the number of cancers with a positive marginal effect here. Now, there's tobacco and alcohol. And you can see the cannabis herb, it's much higher than tobacco and alcohol, which suggests that THC in cannabis herb is a much more potent carcinogen than tobacco and alcohol, which are known. This is the same sort of thing, same sort of exercise. There's tobacco and alcohol. And this is a 2 years lag in a multivariate panel regression modeling. Now, this is our work on aging, some of the stuff we've done on aging. This is very important. This is a paper just published last week in Cell. This is from the Harvard Medical School group. This is a very interesting paper. It's looking at aging and what causes aging. Now, I don't know if you know, but the DNA methylation is on the DNA. It switches the genes on and off. It's one of the principal epigenetic signaling systems. There's about a dozen epigenetic signaling systems. It's very complicated. But what they show is a fantastic paper in Cell, is that this is called Waddington's landscape, that as cells mature, as they differentiate, they move down these valleys and they become more and more different. And with DNA breaks, which happen with time progressively, the DNA methylation has changed, the post-translational modifications change, those remodeling complexes move, and you lose the epigenetic information. That's why we grow old, because old aging is obviously a pattern of progressive loss of function, and so that there's this erosion of the epigenetic landscape that occurs. And drugs like tobacco, which tobacco is mentioned in the paper, will erode that faster because it causes, it disrupts the epigenome, of course, but it actually causes the DNA breaks, double-stranded DNA breaks, which cause the epigenetic landscape to rearrange. And I've just showed you that cannabis is a much more potent carcinogen than tobacco. It causes more DNA breaks, so it's going to rearrange the epigenetic landscape more. And of course, when we look at that we look at cardiovascular age, and it's 30% older, which is important because a recent paper on cannabis aging said that they were epigenetically 30% older. So look, I'll leave it there. That's just a snapshot of our stuff. We've published about 35 big papers. There's another few coming out. So, you know, you can Google my name and find the other details. We've only got a few minutes, but that's sort of it in a snapshot or a nutshell.
Thank you. I thought that was fascinating. I have to say, epigenetics are not my forte, but I think I followed most of it. I thought that was really interesting. And so these substances, they're not kind of classically teratogenic, but it's all the epigenetic mechanisms that are causing these issues to people later in life.
Well, the Sinclair paper that was just published actually makes a very important point, that even, see, they're saying that the aging is driven by the DNA breaks. They say that normally cells experience 10 to 50 DNA breaks, double-stranded DNA breaks a day. So they just introduced 20 DNA breaks into a genome that change, instantly age the cells 50%, just the DNA breaks, because it rearranges the epigenome. And that was not mutagenic. This is not mutagenic DNA breaks. So they're saying that obviously the standard test for genotoxicity is birth defects and cancer. And of course, that's why we've looked at what we've looked at epigenetically. But they're saying, no, you don't need the major mutations. You just need the DNA breaks, because that's what rearranges the epigenome, and that causes aging. And the data is scary, right? The epigenetic study just published said that cannabis cells exposed to cannabis are 30% older. Right now, that's a big deal, because you're talking about aging the whole population 30%. Mitchell published looking at diseases in cannabis people, cannabis, the acute and chronic physical and mental diseases are much worse, which is what you would expect in an older population. Breaks is what rearranges the epigenome. The epigenome controls aging, and you're down the gutter, you're talking about 30%, and that's at the age of 30 years. We looked at cardiovascular age, and we showed that the effective aging actually rises with age. It's 30% at 30 years, but it rises with age, and it rises according to the square of the age. And I wrote to the authors of the paper that said it's 30% at 30 years. And I said, well, what about 40 years and 50 years and 60 years? And they said, we don't have the data. But our biophysical data, we looked at arterial stiffness, cardiovascular, hardening of the arteries is an index of cardiovascular age, which is an important surrogate of general organismal age. And it rises with age, it rises with the square of age. So even without the mutagenesis, even without the birth defects and the cancer, which is scary, right? But even without that, by causing DNA breaks, you're actually aging the whole genome, which is the #1 health problem around the world, the aging population. All of these things in my head are a deal breaker. The public health implications of that are horrific.
Dr. Reece, Dr. Harris mentioned the word teratogenic. Would you say that, especially in exposure to male sperm, the damage to the eggs, or exposure in utero, that cannabis, or we can decipher between just cannabis or marijuana, THC, does it have teratogenic effects, birth defects, the type of concerns we may have currently in this law in our state? Pregnant women will be able to get it. They will be able to purchase it. It's going to be very easy for it to be exposed to children in the homes, the way that our law is currently written. So those are some public health concerns as well for the generational effects that we will see in the development of the brain. Could you speak more to that?
Yes, ma'am, absolutely. There's a lot of evidence now, epigenetically and genotoxically in terms of damage to the DNA, that cannabis is directly toxic to the egg and the sperm. And I completely agree with what you say, that it's very important to protect our young people in that reproductive age group from these genotoxic effects, because in the US, the CDC track, I think it's 62 birth defects, and our studies have showed that over 40 of those are related to cannabis use. In Europe, they track more birth defects. They track 95 birth defects in Europe, and we found that over 80 of those were linked with cannabis. So you're saying that a majority across all body systems, teratogenic syndromes is there, there's lateralization syndromes is there, situs inversus is positive related. There's a thing called Vactral syndrome, which is vertebral, anogenital, renal, cardiac, tracheal, esophageal, and limb. Vactral syndrome is related to sonic hedgehog disruption. Sonic hedgehog is a major morphogen. The babies inside their mothers are sort of woven together, and the cell position, cell specification is set very exactly by gradients of morphogens which overlap, right? So they say, and those gradients very precisely determine what cell goes where. Now, cannabis mucks up those gradients both directly and epigenetically. The egg is a very interesting cell, because eggs are actually formed just after conception. So they have to protect their genome very carefully, because they don't divide much. They're very protected. So anything that comes along and breaks that DNA in the egg will obviously be transmitted to the next generation. So I've written a 3,000-page book on this, which will be out in the middle of the year. So we've just done a literature review, just done all the updates. Every step in male and female reproduction is controlled and run by endocannabinoid system directly, and obviously exogenous cannabinoids muck all that up, but particularly the protection of the genome, which is what's going to, and not just the DNA, but the epigenetics, the RNAs, which are carried to in the sperm and given to the egg at fertilization and control the first steps of cell division. All of that is susceptible to cannabinoid damage. Every step is tightly controlled by the endocannabinoid system.
What was very striking to me in Dr. Reece's research, especially many papers that have come out in the last 2 to 3 years and this year, one is the almost predictive nature of autism rates, that with the increase of marijuana exposure, whether it's labeled recreational or medicinal, that we could start to predict the increased rates of autism in Alabama. And I know, Dr. Harris, you are aware of the scary facts related to that and the costs to people and society and the healthcare system. The other thing that was very surprising this past year in one of Dr. Reece's paper was the connection to cancer in all cannabinoids. So we're not even dealing with just marijuana. The fact that even CBD, because of that olivitol, has so many potent methylation and DNA damaging aspects. And here we have in our state parents giving their children CBD all the time. So I would love for us to continue this conversation, how we can educate, how we can warn, teach in the schools and our clinics, get this out to our medical professionals, because we have a whole system of pseudo healthcare industry promoting what they think is some panacea. And we have these frightening facts coming out. And thank you so much, Dr. Reece, for all of your research and being here with us. And I'm going to introduce Dr. Finn.
You bet. Well, state representative and Dr. Harris, thanks again. Nice seeing you again, Dr. Harris. Shoot me an email if you have any questions after we're done. This is actually a presentation that I plan on doing in 2 days for the Attorney General Alliance. I've been asked to present to 18 jurisdictions around the country to the state leaders on the concerns and public health concerns. These are kind of the bullet points that I want to cover briefly. Use in pregnancy, in utero exposures and outcomes. That kind of dovetails into what Dr. Reece was talking about. Child poisonings, emergency department utilization, potency, etc. Here's a perfect example of normalization to the nth degree. This was actually a police investigation that had nothing to do with cannabis, but During the process of the investigation, they found a storage unit, and inside the storage unit was a Polaroid of an infant with somebody holding a fully locked and loaded marijuana pipe to the baby's face with the nutrient bottle at the wayside. I think this information alone, if marijuana was truly a medication, this data alone would take it off the market, period. So in 2018, 70% of the 400 dispensaries in Colorado recommended women use during the first trimester of pregnancy. And we do know that THC persists in breast milk for up to 6 weeks. And we do know that there is long-term impacts of that. So data point number one, dispensaries are recommending women use. Data point number two, and there's not a lot of states that are looking at this information. Connecticut a few months ago published a paper about substance exposures in babies. And there were 4,700 exposures over 28 months, about over 6.5 babies per day in the little state of Connecticut had some sort of substance exposure. Less than 3% were alcohol, 21% were opioids, but the vast majority exposures were marijuana. Nearly 80% of those 4,700 babies were exposed to cannabis. So that's data point number two. The ABCD study, I'm sure Stuart's familiar with this. They followed these kids to middle childhood. And this is a very large study, nearly 12,000 babies that had been exposed to cannabis. And what they were finding at age 10, so these are 10-year-old kids, that they were having psychopathology with attention, social problems, and scary enough, psychotic-like experiences. So I'm like, well, women use lots of stuff during pregnancy. I did a literature search on psychotic-like experiences on babies that were exposed to heroin, methamphetamine, cocaine, other illicits, and I found nothing in the medical literature about children exposed to substances in utero having psychotic-like experiences. So data point number 3 and 4, that was followed shortly a few months ago by National Institute of Health and NIDA, the National Institute of Drug Abuse. They followed these kids into early adolescence, and those problems with attention, social problems, behavior problems, they persist. So this is long-standing damage to these brains in utero, and the vast majority of them are from cannabis. And again, these data points alone, if this was any other medication that we know, Tylenol, ibuprofen, that had problems in exposure, it would be taken off the shelves. We know there's, you can't point the finger at the mom all the time. I mean, Dr. Reece had talked about some of Susan Murphy's work at Duke. The father that uses may alter the autism gene, and you may have an autistic child possibly because of the father's marijuana use. So it's not necessarily the mom's problem. If you have more dispensaries, you're going to have more pregnancy-related hospitalizations just because of increased use. Here's just kind of a graphic, looking at the animal and human data, looking at exposures in utero and what happens in the animal data and the human data. By the time they're an adult, adolescent, more drug-seeking behavior, problems with the neurotransmitters in the brain. This was a very interesting, this just came out this month. There were 34,000 births, women with a cannabis use disorder. They had a higher prevalence of infant death, pediatric poisonings. The rates of ER visits associated with exposures increased. This was in Canada. So you legalized commercial edible cannabis products was a key factor in changes of ED visits, frequency and severity. Here's the Canadian data. You can look over time. They legalized for recreational purposes in 2018. I actually testified to the Canadian Senate on their bill, and they didn't listen to me. Then you have unintentional cannabis in toddlers. This came in JANA Pediatrics late of last year. And these kids, interestingly, they don't metabolize cannabis or THC like an adult. And the ones that are getting exposed, 4% of these kids, 0 to 5 years of age, end up on a ventilator. So you cannot say marijuana never killed anybody, because if a young child gets a hold of something, they can die due to respiratory depression. Here's a graphic from the New England Journal of Medicine on edible exposures in Canada. here in Colorado, tried to put guardrails and caps and protection. We've had medical marijuana in 2000. We're going on 21 years now, and we've had recreational since implemented 2014. So this is year 9 of that. But despite that, our pediatric exposures continue to skyrocket. And if you talk to any of your colleagues in the emergency room, they will start to see this if they already hadn't started already. Marijuana-related hospital encounters, this was academic pediatrics. This was a huge study. 15% required intensive care, 4% requiring mechanical ventilation. So this is a very dangerous substance, particularly to the very young. This was another American Academy of Pediatrics. This came out very recently, January of this year. In 2017, there were only 207 reported cases of pediatric exposures. And in 2021, there were over 3,000. That was a 1,300% increase, not 100% increase, not 10% increase, 1,375% increase in 4 years. 70% of the cases had central nervous system depression, and nearly 23% end up in the hospital. So here's the American Academy of Pediatrics, pediatric edible ingestions and exposures over time. The state of Texas, if you know, I use them as a reference very often. A lot of states aren't tracking this data. If you have a dead child in the state of Texas, that the substance use by the perpetrator most often is cannabis, either active use or past use, followed by nothing, and then followed by the usual suspects like alcohol, cocaine, methamphetamine, and opioids are way down at the bottom. So if you have a dead kid in the state of Texas, the perpetrator more likely than not is going to have some sort of history with marijuana. This is the stuff we're seeing in the emergency departments. Here's two 14-year-old children came to the emergency department in Colorado with this product. They're drug dealing on Snapchat. That's how they get it secretly. There's mislabeling issues. There's 500 milligrams on the front of the package. There's 420 on the back of the package, probably poking fun at the 420 holiday. So we really don't know how much THC is in this product, but a lot of THC split by 2 children. They ended up in the emergency room with problems. If you have marijuana dispensary density, if you 1 dispensary per square mile, there's a 6.8% increase in marijuana hospitalizations, not emergency visits, hospitalizations. 2016, increased marijuana use after legalization, increased number of ED visits. San Diego, they're seeing 37 marijuana cases a day with mostly psychosis, and that has a lot to do with the potency. And these are, these are the ones that are just being noted. How many are not being noted? How many are slipping under the radar? How many are not even going to the ER, just kind of writing it out at home? Then you have the elderly. This was a great paper just came out a couple of weeks ago. The Journal of American Geriatric Society. Cannabis-related ER visits rated significantly increased for those over 65, 1,800% relative increase in 14 years. That's a huge increase of elderly getting poisoned by cannabis. And this is what you're going to see. It's just going to happen. And you need to monitor this, and you need to track it, you need to publish it, and you need to get the message out there. Cannabinoid hyperemesis, there's a problematic use. It's kind of a chicken and egg thing. We're seeing frequent flyers in the emergency department puking their guts out, all because of their marijuana use. And then they get a $1 million workup, they get labs, they get IVs, they get, x-rays, CT scans, and it's just their cannabis use. And if they just stopped, it would get better. But I would encourage you go to the Facebook page, Recovering from Cannabinoid Hyperemesis Syndrome. They have over 17,000 followers, and read the stories. I mean, I'm not making this up. This is a devastating medical condition. And when you stop using, it doesn't mean it just goes away. Some of the people are reporting weeks or even months of abdominal problems that persist even after they stop. This was a very fascinating paper, which I found very surprising, that marijuana actually has a higher addictive potential than opioids in the early onset users, 12 to 17 years of age. They have here's the graphic. If you look at the 12 to 17 year age kid, after 1 year, there's about a 10-11% addictive rate for both cannabis or opioids. 3 years later, cannabis has a much higher, nearly double the addictive rate than the opioids. I found this very surprising. So delay of onset of use is very important to protect those developing brains. They had monitoring the future data. Here's the monitoring future, the data from SAMHSA that just came out. Depression is a problem. self-harm and mortality. This is a very interesting study. Cannabis use disorder is a risk marker for self-harm and death among youth with mood disorders. If you tie that to some of the other data about, the biggest predictor of an adolescent to use opioids, the number one predictor is having ever used marijuana. So if you have a kid that is using opioids, more likely than not, they have a history of marijuana use. It kind of fits with the gateway theory, which we can debate all day. But this paper shows that those kids that have opioid misuse are increased risk for suicide-related behavior. So we know there's a direct pathway between cannabis use and suicide, but this may be an indirect pathway of adolescent marijuana use, opioid misuse, and then suicidality. This was the American Academy of Pediatrics. And here in Colorado, marijuana is the most prevalent substance found when kids complete suicide. And that never used to be the case. And before 2012, interestingly correlates when we voted to legalize it. It used to be alcohol followed by marijuana. And I can tell you, I've been tracking this data for many years, and the percent, you have 1/5, 1 in 5 completed suicide, teen suicides, 1 in 5 marijuana to be present, much more than alcohol, which is number 2. We know this was a nice study from New Zealand. I know that Dr. Reece is probably familiar with this. They followed, this just came out last year, they followed people, 1,000 people, which is a decent number, from childhood, age 12, to middle age of 45, and they had a 94% retention rate. And they looked at the impacts on the brain from childhood to midlife, and they lost about 5.5 IQ points for those daily, near daily users, not the occasional users. But if some of us are old enough to remember that they took lead out of lead-based paint because it dropped your IQ 4 points, was one of the reasons they removed lead from lead-based paint. Why is this not getting any attention? I have no idea. I'm going to talk about potency briefly. You can see the gap between the CBD content and the THC content widening over time. And this is just the seized by the DEA through 2021. The average smoked flower in Colorado is about 17 to 20%. They are growing strains that are pushing 35% THC. The concentrates that are available in both the medical and recreational dispensaries are between 40 and 60% THC. And now you get into the dabs, waxes, and shatters that are some reporting 100% THC. And there's really little to no CBD in these products. And we know that the THC is the driver for some of these psychotic episodes. Higher potency, increased risk of psychosis and cannabis use disorder. That was Lancet of last year, the American Journal of Psychiatry. Rates and predictors of conversion to schizophrenia or bipolar with substance-induced psychosis. The highest conversion rate was cannabis-induced psychosis. Nearly 47% converted to either schizophrenia or bipolar disorder. And the younger age had a higher association to schizophrenia. And this was a decent study. There was over 6,500 patients that they followed. So we cannot say that marijuana is benign. 230,000 people that use cannabis that came out last September. Cannabis can trigger cannabis-associated psychotic symptoms. They were younger, the elevated risk with high potencies, mixing cannabis with tobacco, history of negative mental health issues. So the data is very clear. You have there's a 5-fold increase of developing a first episode psychosis in daily cannabis use. Violence is an issue. I mean, look at these mass shootings, these acts of violence. I think it's important that, as part of your action plan to have mandatory drug testing on any crime of violence or mass shootings. I've got plenty of data. Ian David Long from California killed, he was a mass shooter in California, killed 12 or 14 people. I have his toxicology report. There was only one substance in his system, it was THC. And I have a laundry list of examples where there is a violent act and the only substance found is THC. And I'm more than happy to share all of that with you.
I do want to say this has actually been very terrific information. I had a couple of things I'd like to follow up with, and I really probably don't have time to do it today, but I'm curious to know if there's in speaking of in utero exposures and the potential complications from that. I'd love to see anything you have. That would be really helpful for us to use to educate people. If I can just add, we absolutely feel very strongly, like you said, we want to follow up on potential complications, whether they're overdoses, clinical overdoses or other complications. We don't have notifiable disease rules in our state at this time that require reporting of, quote unquote overdoses or intoxications, but we do have the ability to require reporting of any, sort of disease of public health significance or, anything like that that we observe, and we fully intend to do that.
Well, get ready for the pushback, because California shot down warning labels. The industry shot down warning labels on potency.
Yeah.
They don't want that. And there's a reason for that. Colorado, California, Washington, Oregon, we had what we describe as unintended consequences. We didn't realize this was going to happen.
Absolutely. Now,
the states that are going down this road clearly should know what is happening in these states like California, Colorado, Washington, Oregon, and these problems that you're having. So I give you a lot of credit for at least eyeballing it and pre-planning, because it's very important that this data is monitored and tracked over time.
Dan Roberts, you got time? One quick question.
Sure. Yes, sir.
I would like to talk either us helping you or you helping us is what I want to discuss, because I'm totally on board with trying to do something. No, you got to go. Thank you very much for joining.
Thank you so much.
Absolutely. Thanks, everybody. Thank you all. Nice to meet you, Dr. Reece. Thank you all.
Thanks. I'm gonna wrap it up here. There's a couple things. I'm just gonna. It's not helping our drug problem, our opioid epidemic. This was a very interesting paper I helped publish in fentanyl overdoses. We know fentanyl has become kind of a scourge, and if you look at the drug overdoses, fentanyl specifically overdoses in non-legalizing compared to legalizing states, we know it's very clear that the ones that have marijuana legalization, this is both medical and recreational, they have a much higher fentanyl overdose death rate than non-legalizing states. So,
okay, Dr. Finn, unpack that for me.
What
do you think that driver is? Is fentanyl being delivered through marijuana?
No, it's not contaminated products. I just think that all these substances play very well together in the sandbox. And if you look at the Colorado data, this was 21. I'm working on the CDPHE and their 22 data. If you look over time, the number of drug overdoses over time were relatively stable through about 2005.
Right.
And then in 2009, we had de facto legalization. That's when all the dispensaries popped up everywhere for medical. And then we voted in 12, implemented in 14. And you can see, this is 2020 data, that the death rates for all of these have spiked. Just because they play well together in the sandbox. You have more access to marijuana, you are going to see more other drug-related deaths. Part of the problem I'm finding is that the coroners and medical examiners don't track cannabis-related deaths. And Dr. Blyer from Oregon has been tracking cannabis-related deaths, because we're looking at this in Colorado, and the number of mentions in drug-related deaths do include cannabinoids. The cannabis, is it a companion drug, or were these deaths in isolation? We do know that cannabis has an impact on arrhythmia, heart attack, stroke, sudden death. It's been, the American Heart Association had a paper on that. And, this was just the data, one of the platforms to legalize is going to help our opioid epidemic and overdose death. So here's Colorado over time, and the darker the color per county, the more death rate. 90% of the marijuana cards are for pain. So here's our deaths over time, and it has simply just gotten worse. And I'm waiting for the 22 data. In Washington, D.C., you can self-certify as a medical patient. So you don't even need a doctor's recommendation. And this started July of 22. And you can see the number of medical cannabis patients over time was creeping up and up and up. And then they changed the law, said, you don't even need to go to the doctor anymore. You can just go to the booth or wherever they're dispensing it and say, I think I need medical marijuana because my knee hurts. And you can Google the number of self-certifying marijuana patients in DC. I'm not making this stuff up. And I think Christine and know my personal story. I mean, I don't use marijuana, but I was curious to see what it took to become a patient. And I got approved in 60 seconds to be a registered marijuana patient in the state of Colorado. No exam, no record review, no MRI review. I didn't make anything up. I need my knees replaced. And I got recertified after a year, and that took a minute too. It really underscores part of the ruse of the medical marijuana programs. Here's some of the data. The number one risk factor for adolescent opioid misuse is use of marijuana ever. The predominant predictor of adult opioid misuse is having used marijuana before the age of 18. You need to have an action plan, and I give you a lot of credit for trying to address this now rather than what Colorado did, 10, 15 years later. Cannabis is a plant. It's not a medicine. We've got a lot of plant-based medications. Christine and Dr. Reece are very familiar with these. I think we need to support drug development process for cannabinoids, including evidence-based dosing guidelines. You need to have a potency cap. That's a battle across the country.
Mhm.
Vermont has been very good at this. You need to put a cap on it. The industry will fight you tooth and nail on it. Monitor and track public health impacts, environmental impacts. I know Alabama is very rural, but you're going to see a lot of illegal grows, trespass grows. I mean, look at New York City. I just got back there visiting our son. The mayor of New York doesn't know what to do with all of the illegal marijuana shops that are all over New York City. The illicit market gets the illicit market all the time in every single state that's gone down this road. Mandatory drug testing for crimes, discourage use during pregnancy, toxicology on suicides, follow ACOG and AAP guidelines for pregnancy and lactation, cannabis-wide health education. The people behind the counter need better education, period. You need warning labels. There's no package insert on medical marijuana. If you get a medicine from the pharmacy, they give you all this paper that ends up in the garbage, but at least educates you and you have a reference to say, what are the harms? What I've been doing recently is I'm having my patients that are interested, for example, in CBD, which has, by the way, over 560 drug interactions, several which are severe drug interactions. And I have my patients go to drugs.com, put in cannabidiol, and look at the medicines they are on, and look how that interacts with CBD. And most of them, 100%, are like surprised that CBD interacts with the laundry list of drugs they're already on. It prompted me to edit this book and found a nonprofit. So I'm going to leave it at that, stop my share, and open it to questions.
I'm going to just add this just real quick, this Alabama data. We have 2021 data, and unfortunately our forensics departments, not all of them report substances used in motor vehicle accidents or deaths. And so this is just really from about half of our counties. And that's another issue that we need support for law enforcement. They need much more funding for the forensics department. We need to have all of our counties testing toxicology on this. Right here, we have our top drugs and traffic fatalities in Alabama 2021. Look at THC Delta 9. It's already at number 2. And that is before, that was the spring when we were actually passing this law. Here are just basically DUI arrests and crashes. Marijuana is already number 1.
Not surprised.
Before we have opened up a single dispensary. We can ask those. Go ahead.
I have a question, actually. What is Alabama's stance on isomerization and acetylation?
Dan, you have worked on some of that with the terpentine and everything, and I don't know if we even have.
I don't know, Ken. I don't.
That's important because what's going to happen is, I think the last time I checked, 15 states restrict isomers and acetylated products. And I can send you a lot of information that what they do, this is thanks to the Farm Bill, by the way, because they mass produce CBD from hemp, and then they manipulate the molecule, which has the same formula. That's why it's called an isomer. And they create things that Dr. Reece had alluded to, the Delta 8s, the Delta 10s. And then they take Delta 8 and they manipulate and they acetylate it. They put the acetyl group on it. And the chemical they use for that is the same chemical they use to make meth and heroin, by the way. And you create these very, very potent products. And THCO is the O-acetate of Delta 8 THC. It's
and I
not.
think we have that. We have that in the state. We have our Delta 8s and Delta aughts and I think everything in between. I think we have no language on acetylation or anything.
You got to get rid of it.
Look,
They're dangerous
we had
and they
to add that to, it's a very long bill, and I've carried that twice. One was just taking care of tiaptanine, phenobut, and one more. Anyway, and you're dealing with gas station drugs, but the profit margins are too good for them to pass up is the entire problem, Ken. And
well, I would still fight it.
Oh, yeah, no, we are fighting it. We will fight it.
Well, keep me posted and I'm more than happy to be a resource for sure.
I mean, what you just went through that litany though is what blows my mind. We schedule a Delta 8 and then you got the Delta alts. Then you, all of these other, the words that you just used to describe these, every one of these, and look, there are companies in both Florida and then Villica, Georgia, that are just hammering these out with usually illegal materials they bring across from Mexico to then manufacture either Florida or Georgia, and then they wind up on our C-store shelves.
And there's no guides and there's no oversight on contamination. A lot of these products may have, you know, for example, an antifungal agent like myclobutanol. When you heat myclobutanol, it turns into cyanide. And that's just one example of the stuff that they're finding in these products. So it's important that you continue to fight the battle and protect public health and safety.
And we have, and all of those items have some degree of, you know, psychoactive impact. And just as Dr. Reece brought up before, the key molecule to the center of it all is the olivitol, which is DNA damaging, transgenerational oncogenesis, meaning you're passing on higher cancer risk to your children and to your grandchildren. So even if the brain isn't affected, you are basically creating kind of what we would call a generational curse. And this is in not only the products that people will purchase in these dispensaries, but from the gas stations, from CBD products. Just depends on what you're looking for. We first have to fight for our most vulnerable, which is our unborn, our children. We have nothing right now that is protecting children from being exposed to it. Adults in the home don't have to put it in any kind of special lockbox. Caregivers can also be registered users. So that means parents can be using at the same time they're giving to their kids, or any, you know, caregiver. I have never been on any anesthesia drugs myself while giving them to my patients. Dr. Finn, I don't think you've done that either in your pain procedures. And then also the issue of the conditions list. When you have conditions such as depression and anxiety as a way to get these products, it's essentially a de facto legalization for everyone. And we will see a scourge of suicides. But I think what will catch a lot of people's attention, Dr. Reece and I talked the other day about this when I was speaking at the SES conference in Montgomery, and a group of teenage girls heard me talk about the impact of cannabis on sperm and the type of children that you just, ill children that you might have. That got their attention. And they said they wanted more information. Teenage girls wanted more information because they did not want to marry a guy like that. Girls and young men do care about children and grandchildren someday, and they don't realize the harm that it can do. Thank you so much, everyone. Any other questions or anything else you want to add? Dr. Reece, Dr. Finn, anybody else?
No, I got to go. I got a stack of patients lining up.
Thank you so
We're
much.
really grateful for you guys, Chris.
Keep me posted. I'm more than happy to share more. You got my email. Send it to whoever's interested.
And they're very
Nice seeing you,
responsive.
Stuart.
I would love for us to come up with a reason to visit Dr. Reece down in Brisbane. I hear it's a great time of year to
Right.
visit.
It's beautiful.
Okay. Thanks so much.
Thank you much. Bye-bye, everybody.